Now, I want to get into the different types of treatments available for patients today because I think that's important. And there are many, but let's start focusing on radiation therapy and chemotherapy, Dr. Koehne.
Well, in general, again, depending on the diagnosis, there is no radiation therapy for leukemia, for example, in the beginning. That's all chemotherapy.
That's all chemotherapy.
There is a stage-dependent approach to non-Hodgkin or Hodgkin's disease. If it's localized to one lymph node, you may just do radiation. If it's more spread, you cannot irradiate the whole body. You have to combine chemotherapy with radiation therapy.
So often these treatments are combined?
Yes.
Maybe two are done at the same time?
May well be. It may just be radiation only. It may just be chemotherapy. Or it may be best to combine to give the systemic treatment with chemotherapy, but also treat what we call a bulky disease or a huge tumor in the chest or lymph node if it's localized with radiation.
And blood transfusions, that's a form of treatment as well?
Blood transfusions are more, there are some hematologic malignancies that will require blood transfusions. Those are the myelodysplastic syndromes, which means your bone marrow does not produce enough of the red cells or enough of the platelets. Then you can transfuse for a while, but these patients will need systemic treatment, if not a bone marrow transplant at some point.
And we're going to get into that in our next segment, as well as immunotherapy. But one of the things you and I were discussing, surgery is not usually an option when you're dealing with the hematologic malignancies, correct?
Surgery is really not any of the treatment approaches that we would count into the combination or at all, except with the exception maybe that the lymph node needs to be removed. It's called excisional biopsy, more or less. But that has been done by surgeons, of course, or interventional radiologists. But it's not necessarily what we include into the category of surgery. So there is no real surgical approach for hematologic malignancies.